Hello, I am Angela Wood, a DNP student at Eastern Kentucky University. This presentation will discuss the incorporation of transformational leadership and Kurt Lewin's planned theory of change in a fall risk screening project for elderly adults in primary care. The National Committee of Quality Assurance report falls as the leading cause of death by injury among older adults aged 65 years or older. Falls result in injuries that may increase the risk of early death and often result in severe disability among their survivors. According to the Healthy People 2020, the cost burden for fall injuries are in the billions, and it is estimated to increase as the population ages. Most falls are preventable, and primary care providers are essential in identifying older adults at risk for falls to prevent death and injury with early interventions. Advanced practice registered nurses working in the primary care setting have the opportunity to be nurse leaders and improve healthcare delivery. A team approach to a fall risk screening project in the primary care setting can help meet the Healthy People 2020 goal to improve the health, function, and quality of life for older adults. The team will represent each area of the primary care setting to include the primary care providers, office manager, medical assistant manager, registration clerk, and the billing clerk. The advanced practice registered nurse will lead the team with the incorporation of transformational leadership and apply Lewin's planned change theory to the implementation component of the fall risk screening project. Burns described transformational leadership in 1978 as the process that motivates followers by appealing to higher ideas and moral values, where the leader has a deep set of internal values and ideas and is persuasive at motivating followers to act in a way that sustains the greater good rather than their own interest. There are 4 components to transformational leadership: idealized influence, inspirational motivation, intellectual stimulation, and individual consideration, and they will be discussed along with each stage of Lewin's planned theory of change. Lewin has 3 stages of planned theory of change to include unfreezing, moving, and refreezing. Lewin's first stage of planned change involves unfreezing. This involves identifying the need for change and motivating others to recognize the need for change. To facilitate buy-in and motivate the team members, the nurse leader will present the negative impacts of falls, the need to address fall risk during clinical encounters, convey the improvement proposal, and the overall project goals. The overall goal for the fall risk screening improvement project is to improve the identification of older adults at risk for falls in the primary care setting to allow for early interventions. And we're going to do this by inquiring and documenting the history of falls, any mobility issues, and a timed get up and go test. The fall risk screening will be performed yearly with all adults age 65 or older during the annual Medicare visit or sooner if there has been a change in status, such as a recent illness or a hospitalization. During this unfreezing stage, the transformational leadership component of idealized influence will assist with buy-in from the team members. The nurse leader must serve as a mentor and role model for the team, earn respect, be trusted by the team members, and convey a clear mission for the project while emphasizing a team approach. When the nurse leader is a role model for the team members, it becomes less likely that there will be resistance to change or new initiatives that are being implemented. Lewin's second stage is moving. This stage involves developing a detailed plan of action and engaging people to try out the proposed change. The moving stage will use the transformational leadership components of inspirational motivation and intellectual stimulation. This stage may be difficult due to uncertainty and fear associated with change. It is important for the team members to understand their roles. There will be regular scheduled team meetings to discuss the implementation of the planned change. The moving stage entails coaching to overcome fears and clear communication to avoid losing sight of the desired target, which is a new improvement plan. Inspirational motivation involves inspiring the team members to meet the goals. The nurse leader will motivate or inspire the team members by communicating with enthusiasm for the project, clearly identifying the project vision, and encourage individual and team passion for the project. Intellectual stimulation encourages team members to be innovative and creative. The nurse leader will encourage the team members to challenge the norm and to think outside the box when developing specific strategies to help incorporate the screening assessment. Involving team members in the decision-making and problem-solving process will help to foster intellectual stimulation. Lewin's final stage of refreezing involves stabilizing the change so that it becomes embedded into the existing system. The refreezing stage aligns with the transformational leadership component of individual consideration. Recognition and appreciation must be provided to individual team members. This can be accomplished through regular feedback to the team members during scheduled team meetings. A new norm or a higher level of performance will be incorporated into the organizational structure and become the standard operating procedure. Various forces drive change in healthcare. The aging population and the healthcare impact of falls is one of those forces demanding a need for change. Poorly developed action plans, undermotivated staff, ineffective communication, and inappropriate leadership are restraining forces interfering with effective change. A transformational leader using Lewin's theory of planned change can assist in meeting the overall goals of the Fall Risk Screening Project. Thank you.